Why do we get sick? What is the reason why our body becomes weak and the immune system low? Is it age, or is there something else to do with it? Insulin is directly related to this. Insulin resistance refers to an unusual process in the body associated with numerous prevalent medical conditions such as type 2 diabetes, obesity, and atherosclerotic cardiovascular disease. Insulin is a hormone produced by the pancreas that aids in breaking down the energy and nutrients we consume into usable substances such as glucose, the medical term for sugar and fats. In situations of insulin resistance, the body does not respond normally to insulin levels when they are produced, leading to various abnormalities. The most frequently observed abnormality is a slight elevation in glucose levels. While glucose isn't always elevated, insufficient insulin production in response to insulin resistance can cause significant elevation, resulting in type 2 diabetes. Numerous factors can induce insulin resistance, but it is commonly linked to excess weight. Excess weight is often stored inappropriately, such as in the liver and other tissues, with fat in the liver interfering with the body's insulin response. Several common conditions are associated with insulin resistance. A frequent condition is fatty liver, but other conditions include polycystic ovarian syndrome, PCOS, and type 2 diabetes. Fatty liver, a diagnosis made by a doctor, occurs when there is excessive fat in the liver. The liver serves as the body's energy processing factory, and extra fat impairs its normal function. Fortunately, during overeating, fat first accumulates in the liver, but during dieting, it is the first place where weight loss occurs. Polycystic ovarian syndrome is another common syndrome linked to insulin resistance without high blood sugars or diabetes, characterized by irregular menstrual cycles and often high insulin levels. High insulin levels in PCOS can contribute to irregular menstrual cycles and increased androgen male hormone levels. Many believe insulin resistance causes type 2 diabetes, but this isn't true unless the pancreas fails to produce sufficient insulin to meet the body's needs. Many people with insulin resistance who are overweight with fatty liver do not develop type 2 diabetes because their pancreas compensates by producing more insulin. However, high insulin levels can drive other abnormal body processes, and weight loss would benefit even these individuals. Insulin deficiency combined with insulin resistance is necessary for type 2 diabetes to develop. Where excess weight is stored greatly influences insulin resistance. People who store weight in the upper body, apple-shaped, are more prone to insulin resistance compared to those who store weight in the lower body, pear-shaped. Central weight storage in the liver and abdominal organs disrupts normal metabolic function. The best treatments for insulin resistance are the same as those for being overweight or obese and for maintaining overall health. Modest weight loss can significantly benefit insulin resistance, achievable through diet and exercise. Simple dietary changes like cutting out sugary beverages and controlling portion sizes with balanced meals help reduce insulin resistance. Exercise alone can reduce insulin resistance even without weight loss. Starting an exercise program can seem daunting, but simple activities like walking for 30 minutes a day or parking further away can make a big difference. People often ask if they should take medication for insulin resistance, but it's not a disease itself. It's an abnormal body process linked to other conditions. Medications may be necessary for associated conditions, but lifestyle changes like increased exercise, healthier eating, and weight loss can dramatically improve insulin resistance and reduce related health risks.